when we do a mindfulness technique in physical therapy, it really also has to do with that person, okay, is holding on to stress and anxiety so much that it's preventing them from healing, from recovering, whether it be an illness or a surgery or just a change in their mobility. Okay. So what I like to do is I like to do a quiet area. Um, I like to do a quiet area, close my eyes, and this is what we're going to do. Okay. So I like to start from the head down to the toes. Okay. Now, I can feel, so I'm going to start with my eyes. Am I squinting? Am I holding on? Am I closing my eyes really firm? Or is it more in a restful pose, right? Okay. Then I start to go a little bit lower. I go into the jaw. Now, a lot of people that I see for TMJ or jaw pain, okay, or the grinding of the teeth, okay. So, what I have people do to rest their jaw is I have their put their tongue on the top of the roof of their mouth, and then you want your lips to gently touch. And by being in this position, we're actually taking the stress and giving our mouth space. So then that way our teeth aren't grinding and our jaw is in a slightly open position. Okay. Then I go into my shoulders. All right. Are my shoulders hiked up? Are they slouched forward? Okay. So then you want to try to open yourself up. So one of the ways that I open up my shoulders is I actually bring my elbows back. Okay. And then I try to tell myself to drop my shoulders down. Okay. And throughout this whole mindfulness technique, it's so important to just breathe. You want to breathe at a very comfortable, natural rate. Okay. So then when we go from our shoulders, okay, now we're going to go into our back. Now, do I feel twisted? Do I feel bent? Do I feel forward? Okay, and just trying to find, where am I in space? Okay, that's so important that when you close your eyes to. Okay, so continuing on with our hips. So when we're sitting and having our eyes closed and comfy, okay, are my hips situated out? Are they in? Are they crossed? Where is the tightness going on in my hips? Okay, you can even say, am I tilted more forward or back? All right. Then going into my knees. Right now, I feel like my hips are lower than my knees. So I kind of feel more strain in my tush, in my hips, rather than in my knees. Okay. And then I start going down into my toes. Are my toes tight and squished like sardines in a shoe? Okay. Do I have a bunion? Do I have a corn? Or, are my toes actually able to wiggle and to feel calm and spaced in my shoes? Okay. And that's why as we do this meaningfulness technique, it really is about finding out where your body is in space and taking that time to focus onto whether or not that body part is holding on to unnecessary stress, tightness, laxity, or, sometimes we can be too flexible. Okay? Do you feel like unstable in a joint or super tight in one nearby? Okay, these are the things that we notice when we do a mindfulness technique with physical therapy. If you really like this video, go ahead and press like, share, subscribe, tell your friends and neighbors. Janet D, the PT.